consumer of mental health services. I represent the voices of 44,000 people receiving public mental health services and also 312 patients at the Utah State Hospital. Recovery is possible. I am proof of that. Diagnosed with a mental illness at the age of 15, I struggled with years of alcohol and drug addiction, and during the 25 years of being a mental health consumer, I was hospitalized several times, 2 of which were at the Utah State Hospital. I stand here today as someone who enjoys giving back to the community that so graciously saw me through my struggle. We cannot forget the most vulnerable. I speak of the many people who sit in silence with a mental illness because of discrimination, stigma, lack of support or resources, and are living in fear. Because sometimes their voices are not heard, I speak for them now. People with mental illness in Utah are dying on average 25 years earlier than the rest of the population. When I hear that, I stop. I take notice. I remember people like my grandma, Blanche Brzezinski, who died in a state hospital in California. I want to change this statistic for my peers so they can live longer, happier, peaceful, healthier lives. For the last few months, I've been representing the consumer voice on the Recovery Plus project, which is the initiative to eliminate tobacco products in public treatment environments. As an ex-smoker and knowing my peers are dying 25 years earlier, this has become an important implementation for me. We as a community can help people with serious mental illness through prevention and intervention and recognizing it early, even in our youth. We have over 800 homeless youth sleeping on our streets of Salt Lake County on any given night, and 83% of them have reported being diagnosed with a mental illness. We need community compassion and involvement when it comes to these children that have been abandoned to live on our streets, especially through family education of mental illness, which is where I'd like to recognize Sherry Whitworth and the great work she has done in this area and in NAMI, and all the advocacy work she has done at the Capitol during the legislative session. Sherry has been a great example to me when it comes to advocacy work with the family, and I thank her for that. Some of the work I started spearheading here in Utah is that of peer support, as I chair the Certified Peer Specialist Task Force for the state. I believe so much in the recovery of my peers, like those that you see in the posters here about them, and the life stories that they tell. Through peer support, they can become trained certified peer specialists and work with their peers in many different settings, such as hospitals, emergency rooms, warm lines, crisis intervention, outpatient clinics, ACT teams, and in the community. One peer support worker's story of recovery can give another so much hope because of the bond we share actually knowing what it's like to live with a mental illness. Now this is change. Recovery means to be in constant forward motion. I may not always be perfect, but I have regained hope. I have a will to live and a sense of joy. I think with this recovery, I cannot keep it to myself, so I share it with others. I want them to know all the goodness I have found. I help others who are struggling to find their way, and I want to give them the love and the encouragement that was so often given to me. What has catapulted me into this state of recovery the most is for me to finally be able to use my voice and to continue to use it even in the midst of fear sometimes. Then I teach it to those who are not yet awake to the fact that they too have a voice in this world. This is a glimpse of my recovery. Thank you.